Thank you so much for watching today. Today I have with me Alex Fisher of Thompson Burton in Nashville. She's an associate here, and she works a lot with nurse practitioners and deals with the Board of Nursing. So I thought it'd be a great idea to get some of her insights into why nurse practitioners commonly get into trouble with the Board of Nursing. So thank you so much for being here, Alex.
I'm happy to be here.
What reasons do you usually see nurse practitioners brought before the Board of Nursing or have complaints from the Department of Health filed against them?
What I typically see with nurse practitioners are prescribing issues. So prescribing without documentation. I also see ethical issues. So perhaps having a personal relationship with a patient, things of that nature, maybe misdocumenting something, lying in your documentation. And then, of course, criminal issues. If you're convicted of a crime, that can often lead to repercussions with your professional license.
Got it. And so I assume that nurse practitioners aren't really reporting themselves to the Department of Health. How do these complaints get filed? Who's bringing these things up or reporting them about the nurse practitioners to the Department of Health?
That's a great question. So in Tennessee, the Board of Nursing is a complaint-driven process. So what that means is most of the investigations are begun by complaints brought to them by the public. So the public can be anyone from your supervising physician to an administrative assistant in your office to another nurse you work with to a patient or a family member of a patient, or even kind of another extreme I see are ex-husband, ex-boyfriend, ex-wife of a provider who makes a complaint against them to the Department of Health.
All right, so it sounds like some are founded and some are not so unfounded.
That is very true.
Let's kind of go through those different violations that you listed and talk about them in a little bit more detail. So let's start with prescribing without documentation. Talk a little bit about what happens and where nurse practitioners really run into a problem with prescribing or without documentation.
So the main thing, as you might imagine, are prescribing narcotics or controlled substances without documenting. And when I mean documenting, I mean showing justification for the prescription you wrote, as well as showing that this person is a patient of yours. So there's no regulation saying that you can't write a prescription for a friend or a family member, but you need to have documentation on them and a patient chart the same way you would for any other patient.
Got it. I think that's definitely an important reminder. I think a lot of us fall into the, oh, hey, my kid at home has an ear infection. Do you mind just writing a little bit of amoxicillin? And really that has a lot of legal ramifications. So thanks for that reminder. What about kind of ethical, moral issues? You mentioned documenting things that are, for example, never happened, or kind of fudging your charts a little bit. Talk about that and what you commonly see with that and the implications of falsifying documentation.
That's a big thing I see, and the Board of Nursing knows that nurses and nurse practitioners are overworked. You guys are a very stressed out profession, and so when you're seeing 20, 30, 40 patients in a day, they know that you might not have time to check the vitals on each patient, to get the appropriate patient records or ask all the questions of everyone. But what the Board of Nursing looks at really seriously is falsifying documentation in your chart. So they'd rather see a nurse or a nurse practitioner who didn't document something than someone who falsely documented something and then later find out that they didn't really perform a test or didn't really check vitals or didn't really ask those questions of a patient that they were supposed to.
Right. I think, we all know that this happens. I saw a cartoon the other day kind of poking fun at how no one has actually checked a respiratory rate since nursing school. So it definitely does happen. We all have to admit it. So it's good to realize that can actually really affect your practice, your licensure. You mentioned when we were talking earlier one story about a case where some documentation was falsified, but the person came clean about it. Can you tell me that story again and just sort of what to do if you get into trouble with that?
Thanks for that. That's a good reminder. So last week I was actually at the Board of Nursing meeting, and there was a nurse there who had forgotten to take 2 tests on a patient and hadn't documented vitals later that day. And he was completely honest about it. He was very forthright. They presented a lot of evidence showing that he hadn't falsified anything, which was what the Department of Health was trying to say had happened. And in fact, he got no discipline from the Board of Nursing. And what they said in their deliberations was, we know that, there's no nurse that's perfect. There's no one who has, never forgotten to do a test or document something. And as long as you're honest about it, that's what we're most concerned about.
Right. And I think that's kind of a relief, because when we're talking about getting in trouble, it instills a lot of fear in us, because mistakes do happen, but if you do make them, be honest about them. So let's talk now about criminal activity and convictions. Those obviously affect your nurse practitioner license in some way, but there are a variety of criminal convictions. There's murder and rape, and then there's, the parking ticket I got last week. Which ones will actually affect your license?
So that's a good question. The ones that really seriously affect your license are violent crimes. So murder, rape, assault, kidnapping. Those are things that the Board of Nursing looks at and says, hey, maybe we're not going to trust this person with taking care of patients on an individual basis. The things that clients come to me most about are things like simple misdemeanors, so DUIs. And the important thing to remember with those, the Board of Nursing is concerned about any sort of criminal conviction, but say, for example, a DUI, if you show that you paid all your court costs and that you provided restitution and that you went to rehab if you needed to, they're most concerned that you're fit to work and that your criminal conviction doesn't indicate that you're somehow not fit to be a good nurse practitioner.
Okay, great. So if you do get into trouble, should you call the Board of Nursing and say, hey, I got a DUI last week, what do I need to do about this? Or is this something that you can kind of wait and see what happens, wait until they find out? What steps should you take if you do find yourself in some sort of legal trouble in your personal life? What do you need to do professionally about that?
First, I would recommend for all providers to be familiar with the regulations of their profession in their state. So these can really differ from state to state. Tennessee Board of Pharmacy used to require reporting within 10 days. They don't anymore. Tennessee Board of Nursing doesn't require that you self-report currently. But it's important when you're renewing your license to read through those questions carefully, and where you might previously have checked no to a criminal conviction, make sure that you're forthright and check yes if you have had a criminal conviction in the time since you last renewed your license.
Okay, great. So it sounds like know your state laws and regulations, but you may not actually have to report that. When it does come out, be honest about it. You'll find yourself in the best legal situation possible. So thank you so much for being with us, Alex. Alex Fisher works at Thompson Burton. She practices here in Tennessee, but she's available to answer questions from nurse practitioners all across the country. So if you have any questions about sort of the legal space when it comes to your personal or professional life, feel free to reach out to Alex. She's happy to help.
Thanks, Erin.
Thanks.